If a herniated disc is pressing on a nerve in your lower back, this operation may come up. Between each vertebra sits a soft disc. When its inner gel pushes out, it can press on a spinal nerve. This nerve pressure often causes sciatica, sharp pain, tingling, or weakness that travels down the leg. Doctors usually try rest, physiotherapy, and medication first. Many disc herniations settle over several weeks without surgery. Surgery is considered when leg pain lasts weeks despite treatment, weakness worsens, or an MRI confirms clear nerve compression. Microdiscectomy is a focused, minimally invasive surgery that removes only the small piece of disc pressing on the nerve. The patient is asleep. Through a small incision in the lower back, the surgeon uses a microscope to reach the nerve. A tiny window is made in the bone. The nerve is gently moved aside, and the herniated fragment is removed. The surgery usually takes 45 to 90 minutes. No screws, rods, or fusion. The spine stays mechanically intact. Most patients stand and walk within hours. Many go home the same day or the next morning. Leg pain often improves quickly. Desk work resumes around 2 to 4 weeks. Heavier jobs closer to 6 to 8. Risks are uncommon, but include infection, a small tear in the nerve covering, or the disc herniating again later. Long-term spine care matters. Core strength, good lifting technique, staying active, and healthy weight all protect the back. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.